Hi, I'm Gail Harrison, and I'm going to do a scenario using the ER, and we'll have an individual in here that is experiencing anaphylactic shock, and I'm going to show them and demonstrate and do a TeachBack session on how to use an EpiPen. I have taken the interventions from 5 different things in our module. The first one is encourage family participation and care, and that was taken from the 6 steps to creating a culture of person and family engagement in healthcare. I took quite a few different interventions from the TeachBack module at www.teachbacktraining.org, and a few of those include using a caring tone of voice and attitude, using comfortable body language and making eye contact, and if the patient is not able to teach back correctly, explain again and recheck. From the Ideal Discharge Planning Implementation Handbook, I took the Listen to and Honor the Patient and Family's Goals, Preferences, Observations, and Concerns. And from the Module 6 PowerPoint presentation titled Patient and Family as Partners in Care, I took the intervention of providing specific information about any follow-up appointments. And from the patient's perceptions of the quality of discharge teaching and readiness for discharge article, I took the communication must be at the level understandable to the patient and or family caregiver, so using common language rather than medical jargon or terminology.
Hello.
Hello. Hi, my name is Gail. I'm a student nurse, and I'll be working with your nurse Mary. And can you please tell me what your name is and your date of birth?
My name is Alexander John Harrison, and I was born on 2/18/99.
Okay, and who do you have here with you?
This is my mother.
Hi, and your name is?
I'm Leslie.
Hi, Leslie. Nice to meet you both.
Nice to meet you.
Okay, that sounds good, because we like to have our patients come in with family members, because it always helps out to have someone else to be knowledgeable of what's going on with your health care. So that's great that you came with them, Leslie. Okay, so what we're going to do here today is we're going to go over how to use the EpiPen. I hear that you had an instance where you were stung by a bee and you had a bad reaction to it, correct?
Yes.
And what happened? What happened when you were stung by that bee?
Whenever I got stung by the bee, my throat started to close up and it became hard to breathe, and I got hives around the affected area.
Okay, good. That was good that you came to the ER then to get medical treatment quickly. Now, some of the other symptoms that you might experience, you might get you might get confusion. Did you notice your heart beating any faster?
A little bit.
Okay, that'll happen commonly as well. And like you said, you might get a rash or hives on your skin, get itchy, especially around the area that you were stung at. So those are common signs and symptoms that you'll experience from getting stung by a bee. We're going to go over how to use this EpiPen today, but I'm going to give you this sheet that goes along. It's an explanation on how to use it and a lot of information about what the EpiPen is used for. And before we go into any more detail about the EpiPen, I wanted to cover a little bit about any medical conditions you may have, just to kind of double check. Do you have any heart problems or high blood pressure?
No, I do not.
Okay, how about diabetes?
Nope.
Thyroid conditions?
No.
Okay, do you have any asthma?
No.
No? Okay, how about a history of depression?
No.
Okay, and do you have any other medical conditions that you might have thought of after you talked with the doctor earlier? Anything that you wanted to share?
No.
No?
Not
okay.
mine.
Okay. You're not currently taking any prescription medications or non-prescription medications, but I wanted to double check and make sure that, check with you about vitamins. Sometimes people forget to tell us about vitamins or any herbal medications you may be taking. Are you taking anything like that?
I'm not taking anything.
Okay. All right, that's good. That's good. So some side effects from the EpiPens, like your heart pounding in your chest, so you'll have a real fast heartbeat. That's pretty common. And also you might start sweating, and you might actually get a headache afterwards. Okay, and then when you get the EpiPen, it'll come in a little container, so it'll be enclosed in a clear container, have a little yellow lid, and you'll flip the lid and you'll just slide this out, and this is what you'll have is your EpiPen. And when you use the EpiPen, you need to make sure that you take the safety off. So this safety is here to help prevent you from accidentally sticking yourself with the needle. So you want to be really careful when you're using the EpiPen, and make sure that you don't accidentally inject it into your hand, your foot, your arm, or anything like that. If you do that, you need to make sure that you seek medical attention immediately, because this is only designed to be injected into the side of your thigh.
Okay.
Okay? So how you use this, I'll demonstrate. I'll stand up so you can get a little bit better look, but you will take this off. This is a safety cap. See here? That's a safety. So if you were to try to depress this, nothing will happen with the safety on. So I'm going to take the safety off, and now the EpiPen can actually engage and inject the epinephrine into your leg. So what you'll do is you get a good grip on it, and then you'll take it, and on your outer thigh, you'll push it into your outer thigh when it clicks like that, and you'll hold it there for 10 seconds. So you might want to count 1, 1,000, 2, 1,000, 3, 1,000, up to 10.
Okay.
You hold it there, then you release it, and then you'll see that this is extended downward, and what that's done now is it's protecting the needle so you don't actually poke yourself with the needle, or no one else, your mom doesn't accidentally poke herself with the needle afterwards. So you want to lay this aside, and you want to make sure that once you do use it, you do take it with you when you go to the hospital, because after you use the EpiPen, you need to go to the hospital. And say you use the EpiPen and a couple of minutes later, you're still feeling that difficulty breathing, or say it's gotten even worse, because it should start getting better fairly quickly. If you still feel like you're having difficulty breathing, your prescriptions always come with 2 EpiPens, so you can actually use the other EpiPen again, as well. Don't use any more than 2. You can use the 2 and get to the hospital as quickly as possible. Okay, so I want to give you this and have you demonstrate how to use it.
Okay. First, I'd firmly grasp it.
Okay.
And then I'd stick it in my thigh.
Okay, did you hear that click?
No.
Oh, what do you think you might have done incorrectly?
I think I may have not taken the safety off.
Okay, so you take the safety off, and then what would you do?
And then I stick in my leg.
Okay,
Listen
and
for
where
that.
on your leg?
On the outer thigh.
Okay, good.
And then I wait for 10 seconds.
Okay.
And then I take it off. And nothing's out.
Okay, so
That's
now
pretty
no
much
one
it.
else will get pricked by the needle or anything. So that's good. And then do you take that with you when you go to the emergency room?
Yes.
Okay, good, good. And then if you don't feel any relief from, say you were having difficulty breathing and you took this and you don't feel any relief, can you use another one?
Yes.
Yes, okay. And can you use 2 more?
No.
No, okay.
One more.
Okay, right. So you only want to use 2 at a time for one instant. One other thing about this EpiPen, well, let's have Leslie. Could you demonstrate how to use it first?
Sure. And you said only the outer thigh, right?
Yes.
You
Yeah.
can-
The outer thigh area.
Okay.
So right
Like
in.
this. Hold it for 10 seconds.
Mhm. Yep.
Okay. And that covers the needle.
Yeah.
All right.
So it's pretty
I think
easy.
we got it.
Right. So like I said, you'll have it in a little carrying case, and you'll want to make sure you have it with you at all times. You want to avoid any extreme heat or extreme cold. So do you think it's a good idea to take these and put them in your glove box in the Florida sun?
No.
Probably.
No. Do you have any questions about how to use the EpiPen, or what it's used, what are there, any other questions?
How do I know when it goes bad?
Okay, that's a good question. What you'll have an expiration date on the EpiPen itself, and then on a real EpiPen, see, this is just our trainer, it doesn't have it, but on the real EpiPen there'll be a little window here where you'll actually be able to see the liquid that's inside the medication, and the medication in that window should be clear, and it should be like colorless. If that medication has gone bad, it'll turn like a brown color, and it may get cloudy as well.
Okay.
So you'll wanna look at that. So you'll wanna inspect these occasionally to make sure that they're still effective. So, do you have a question?
Yes. Then how would we get another prescription for it if it does go bad? Let's say, do we call our primary care, or who prescribes those for him?
Well, actually, what we're going to do is, as we talked earlier, we went ahead and set up an appointment with your allergist, and he will be able to provide you with a prescription, another prescription. When you leave here, we'll make sure that I've got your script right here for the first set of them, but your allergist will be able to provide you with a prescription, or your primary care physician. Do you have any other questions?
Nope.
Okay. Thank you.
Here we
Okay,
go.
great. All right.
Bye.
Okay, bye-bye.